I'm going to review some of the major parts of the heart. We have the auricle of the right atrium, right ventricle, left ventricle, auricle of the left atrium, and the left atrium. This structure here represents the pulmonary trunk. That's going to give rise to two vessels, the right and left pulmonary arteries. They're going to bring blood to the lungs. Blood returning from the lungs is going to come back via the pulmonary veins. They're going to empty into the left atrium. This represents the ascending aorta. This represents a part of the superior vena cava. This is the orifice for the inferior vena cava. Coming off at the base of the aorta are two major blood vessels. We have the right coronary artery and then the left coronary artery. We can't see it coming off the base because of these other structures. The left coronary artery is very short. It gives rise to this blood vessel here, which is the anterior interventricular artery, and then this artery here, which is the circumflex artery. The circumflex artery travels around and anastomoses with the right coronary artery. We can see here's the right coronary traveling around, and then the right coronary artery gives rise to the posterior interventricular artery. On the venous side, we have the great cardiac vein that travels all the way around and empties into the coronary sinus that sits in the coronary sulcus. If we open up and take a look inside the heart, this is the chamber of the right atrium, and within the chamber of the right atrium, the posterior wall is smooth, but the anterior wall is going to have grooves that represent the pectinate muscle, which we can see here. And this is the auricle of the right atrium that has also pectinate muscles throughout. This structure here represents the valve between the right atrium and right ventricle. That is the tricuspid valve. And we go into this chamber here, and that's going to be the right ventricle. Within the right ventricle, there's this muscular grooves that represent the trabecular carne. This portion of the muscle protruding up to connect to these fibers is going to be the papillary muscle. The papillary muscle connects to these fibers, which are the chordae tendineae, which then attach to the cusps of the valve. They help prevent the valve from everting. We can see the interventricular septum, the muscular wall of the heart. On this side here, similarly with the left ventricle, we have the trabecular carne, the papillary muscle that connects to the chordae tendineae, and then the valve on this side is the mitral valve. Here we see the left atrium, and it's smooth throughout, but the auricle has the muscular ridges, which represent the pectinate muscle. With regard to some of the other valves, we have this valve here. This is going to allow the blood to flow from the right atrium into the pulmonary trunk, so that's the pulmonary valve. And then this one over here represents the aortic valve, allows blood to flow from the left ventricle into the aorta. So that represents the major parts of the heart.